Nursing 474, Historical Aspects of Community Health Nursing. The weekly learning objectives include describe specialization in public health nursing and community health nursing and the practice goals of each. Identify clinical community health nursing practice with population-focused practice within your own community. Describe contributions made by early nursing leaders and their application in community health in a modern world. And lastly, discuss the core competencies of public health nursing. The history of community-oriented nursing reflects changes in specific focus of the profession while emphasizing continuity in approach and style to improve the health status of individuals, families, and populations, especially those who belong to vulnerable groups. Part of the appeal of this nursing specialty has been the autonomy of practice and independence in problem solving and decision making done in the context of multidisciplinary practice. Many varied and challenging public health roles originated in the 1800s when health efforts focused on environmental conditions. Although manifestations of these health threats have changed over time, the foundational principles and goals of public health nursing have remained the same. Public health during America's colonial period and the New Republic. In the early years of American settlement, the informal system of care by women of the family became insufficient. The model of the Elizabethan Poor Law was used by colonial Americas to establish care systems for the sick, poor, aged, mentally ill, and dependent. During the colonial period, many epidemics occurred. Public health efforts aimed at fighting these epidemics included the collection of vital statistics, improved sanitation, and avoidance of exotic diseases. After the American Revolution, there was an interest in establishing boards of health. The first public health committee was established in New York City in 1800. These efforts addressed the epidemics of smallpox, yellow fever, cholera, typhoid, and typhus, as well as the high rates of tuberculosis, malaria, and infant mortality. In 1798, the Marine Hospital Service was established to secure maritime trade and seacoast cities from epidemics. This agency is known today as the United States Public Health Service, USPHS, and is still the most important federal public health agency. During the early 1800s, early experiments at a local level in providing nursing care at home focused more on moral elevation than illness intervention. The Shattuck Report, published in 1850 by the Massachusetts Sanitary Commission, was a major initiative to establish a state Department of Health and local health boards in every town. Nightingale and the origins of trained nursing. Although people have been concerned for centuries about the health care of individuals in the community, the vision of trained nurses and a model for their education was missing until Florence Nightingale developed the organized discipline of nursing in the mid-1800s in England. During the war, Florence Nightingale was asked to go to Scutari in Asia Minor, along with a contingent of ladies, hired nurses, and paid servants to improve conditions for the sick and injured soldiers. Nightingale used a population-based approach and epidemiological measures to improve the environmental conditions and nursing care by mobilizing resources and organizing the community to meet their needs. Nightingale returned to England to organize hospital-based nursing practice and education to replace untrained nurses and emphasize public health nursing. America needs trained nurses. During the 1870s, the first nursing schools based on Nightingale's model opened in the United States. Graduates of these early programs usually worked as private duty nurses, hospital administrators, or instructors. The public's interest in limiting disease among all classes of people for reasons of religious charity was expanded by fears of the impact of communicable diseases that originated in large communities of new immigrants from Europe. Because nursing practice in the community included teaching and prevention, the nurse became the key to communicating the prevention campaigns for communicable diseases through home visits and well baby clinics. In some areas, this was referred to as instructive district nursing. Settlement houses, or neighborhood centers, became hubs for healthcare, education, and social welfare programs. The most famous of these settlement houses was the Henry Street Settlement, established by Lillian Ward and Mary Brewster in 1893. Later, this became the Visiting Nurse Service of New York City. The American Red Cross, through its rural nursing services, later known as the Town and Country Nursing Services, offered home care services to the sick and instruction in sanitation and hygiene in rural communities. After World War I, the Red Cross Town and Country Nursing Services expanded to almost 3,000 programs in small towns and rural areas. In 1895, occupational nursing began as industrial nursing, an outgrowth of visiting nurses, with Ada Mayo Stewart at the Vermont Marble Company. The growth of occupational nursing reflected increased governmental and employee concerns for health and safety at work. School nursing in America. In 1902, school nursing grew out of school absences caused by the prevalence of infections and communicable diseases such as lice, ringworm, scabies, inflamed eyes, discharging ears, and infected wounds. The school nurses found that many children were absent because they lacked shoes or clothing, were malnourished, or were serving their families as babysitters. School nursing was quickly adopted in other major cities. The profession comes of age. In the 20th century, professional publications, nursing organizations, and standards for nursing education related to community and public health nursing were established in the United States. They have continued to evolve and adapt to meet the nation's healthcare needs. Public health nursing in official agencies and in World War I. Public health nursing in voluntary agencies and through the American Red Cross grew more quickly than public health nursing sponsored by state, local, and national governments. By 1900, 38 states had established state health departments following Massachusetts' lead in 1869. In 1912, the federal government defined the role of the USPHS to empower the agency to investigate the causes and spread of diseases and the pollution and sanitation of streams and lakes. Inadequate funding was a major obstacle to extending nurses services in the community. In 1909, Lillian Wald and the Metropolitan Life Insurance Company established a collaborative program to have visiting nurses assess illnesses, teach health practices, and collect data from policyholders, resulting in a decline in mortality rates for policyholders. Despite these findings, efforts to increase voluntary or health insurance programs evaporated by the end of World War I. In 1912, in response to advocacy by Lillian Ward and other nurse leaders, the Children's Bureau was established to address problems of maternal and child welfare. The Bureau conducted extensive scientific research on the effects of income, housing, employment, and other factors in infant and maternal mortality, leading to federal child labor laws and the 1919 White House Conference on Child Health. In 1925, the Frontier Nursing Service was established by Mary Breckinridge to emulate systems of care in the Highlands and the islands of Scotland by providing programs to the rural and inaccessible populations in the Appalachian region of southeastern Kentucky. Nursing education was absolutely segregated in the South and generally segregated elsewhere until at least the 1960s. African American nurses seeking to work in public health nursing faced many challenges until 1936, when the collaboration of USPHS and the Medical College of Virginia established a federally funded certificate program in public health nursing for African American nurses. The economic crisis during the Depression of the 1930s deeply influenced the development of nursing. Agencies and communities were unprepared to address the increased needs and numbers of impoverished because of decreased funding for nursing services. Conflicting visions and splintering of services between the visiting and the public health nurses further impeded development of comprehensive, community-oriented nursing services. Increasing federal action for public health Expansion of the federal government during the 1930s was the beginning of a new era for public health nursing. In 1933, Pearl McIver was the first nurse employed by the USPHS to provide consultation to the state health departments. McIver increased the strengths and quality of local health services by increasing the hiring of public health nurses in leadership roles within local health agencies. The Social Security Act of 1935, designed to prevent recurrence of problems of the Depression, provided funding for education and employment of public health nurses to support increased funding for states, counties, and medical districts in the establishment and maintenance of adequate health services. The onset of World War II in 1941 accelerated the need for nurses. Many nurses joined the Army and Navy Nurse Corps. In 1943, the Bolton Act established the Cadet Nurses Corps, increasing enrollment in schools of nursing at undergraduate and graduate levels. Other programs, such as training for nurses for national defense, the GI Bill, and the Public Health and Professional Nurse Traineeships, provided additional educational funds that expanded the number of nurses, including public health nurses. Changes after World War II subsequently affected community health nursing by introducing new service challenges, while expanding other services through advances in science and medicine into saving lives, identifying disease, and prolonging life. Job opportunities for public health nurses grew in health departments, visiting nurse associations, industries, and schools. Between 1900 and 1955, the national accrued mortality rate decreased by 47%. Americans survived childhood and early adulthood to live to middle age and older. The leading cause of death in 1900, which was pneumonia, tuberculosis, and diarrhea enteritis, was replaced by mid-century by heart disease, cancer, and cerebral vascular disease. Because the Depression and World War II divided public policy and nursing, this emerging problem was not addressed. With extended lifespan and increased duration of life after diagnosis of chronic illnesses, nurses face new challenges related to chronic illness care, long-term illness and disability, and chronic disease prevention. In 1949, home care programs began to adopt a multidisciplinary and sometimes comprehensive approach to complex patient care, such as the use of physical and occupational therapy, nutrition, consultation, social services, laboratory and radiographic procedures, transportation services, and auxiliary nursing personnel like housekeepers, homemakers, and home health aides. During the 1950s, public health nursing, like nursing generally, increased its focus on psychological elements of client, family, and community care, expanding the nurse's responsibility for health and human needs, a comprehensive approach that included the physical and emotional components of a person. During the 1930s and 1940s, hospitals gradually became the preferred place for illness care and childbirth because of improved technology, concentration of physicians' work in the acute care setting, and the development of health insurance plans such as Blue Cross plans, which made hospital-based care affordable to the middle class. After World War II, federal health policy supported the growth of institutional care in hospitals and nursing homes over community-based alternatives. This subsequently weakened the public health leadership and its specialty. The NLN adopted the recommendations of the 1948 Nursing for the Future report to establish basic nursing preparation in colleges and universities, which was consistent with the goals of public health nursing concepts in all BSN programs, thereby upgrading the profession of public health nursing. In the 1950s, public health educators considered steps to enhance undergraduate and graduate education for public health nurses, divided between schools of nursing and schools of public health. Beginning in the 1940s, but on the basis of advocacies in the 1910s, policymakers and social welfare representatives sought to establish national health insurance. In 1965, Congress amended the Social Security Act to include insurance benefits for older adults, Medicare, and increased care for the poor, which was Medicaid, but failed to include preventative services and limited home health care to those services ordered by a physician. There was a rapid proliferation in home health care agencies, and local and state health departments redesigned their programs to provide reimbursable services. At times, this reduced the focus on health promotion and disease prevention services. The social changes of the 1960s and 1970s influenced the practice of public health and community-oriented nurses. New programs addressed economic and racial differences in healthcare service and delivery, funding for maternal and child health, mental retardation, and community health training. In 1964, neighborhood health centers, Head Start, and other community action programs were launched. Other major factors influencing community health during the 1960s included the development of the nurse practitioner movement in 1965, which opened a new era of nursing involvement in primary care, improved access to populations in rural areas, inner cities, and other medically underserved areas. Nurses made powerful contributions to the hospice movement, the development of birthing centers, daycare for older adults and disabled persons, drug abuse programs, and rehab services in long-term care. The federal evaluation of the effectiveness of care was emphasized. By the 1980s, the rising costs of health care caused the diversion of funds from health promotion and disease prevention to meet the escalating acute hospital care, medical procedures, and institutional long-term care. The use of health maintenance organization, HMOs, which was encouraged, and the use of nurse practitioners increased. Home health care weathered several threats to adequate reimbursement, and by the end of the decade had secured favorable legal decisions that increased its impact on the care of the sick at home. The Institute of Medicine's report, IOM, The Future of Public Health in 1988, found the state of the public health in the United States to be in disarray, with great variation across the states. Although there was agreement on the mission of public health, there was little consensus on how to translate the mission into action. The report determined that contemporary public health was less defined by what public health professionals know how to do than by what the political system in a given area decides is appropriate or feasible. The Healthy People Initiative has influenced goals and priority setting in public health nursing. In 1979, Healthy People proposed a national strategy to significantly improve the health of Americans by preventing or delaying the onset of chronic injuries and infectious diseases. A framework for periodic evaluations led to a new set of detailed objectives every decade. The 1990s debate about healthcare focused on central issues of cost, quality, and access to direct care services. Despite interest in healthcare reform and universal health insurance coverage, the core debate of economics of health emphasized reform of medical care rather than comprehensive changes in healthcare. In 2010, the Patient Protection and Affordable Care Act was passed by Congress, with professional nurses' continued support for improved access, reduced costs, and the extension of public health services to prevent illness, promote health, and protect the public. The Quad Council supported the efforts of its organizational members and public health organizations to establish mechanisms to improve quality of care and advance the public health nursing profession in the 21st century through certification, faculty qualifications, and publications on the importance of public health nurses within public health systems. In the last decade, new populations, privatization of official health services, nursing shortage, natural and human-made disasters, and bioterrorism have challenged the public health and community-oriented nursing to provide services to meet specific needs. Nurses look to their history and use information and advocacy to learn from the past, avoid known pitfalls, and seek successful strategies as they promote a comprehensive approach to address the multiple needs of the diverse and vulnerable populations they serve. Public health and community-oriented nurses are sustained by their vision of what nursing can accomplish.